The public option, a hugely controversial issue, was in the House bill, is not in the Senate bill, and the president has stuck with that. He would establish, though, a health insurance rate authority that would provide federal assistance and oversight to the states to conduct reviews of unreasonable rate increases or other unfair practices. Now, some of you may be familiar with the fact that last week, actually a couple of days before the summit, Anthem Insurance Company in California, division of WellPoint, raised the rates in California by, for some folks, up to 39%. Now, why they picked that week to announce that kind of a rate increase was a very interesting strategy on their part and a pretty foolish one. And I'll tell you, I think that that act alone is going to be one of the biggest game changers in this whole healthcare reform effort, because people were becoming complacent. The advocate community was exhausted. Everybody was so tired. And when they did that, when they announced 39% rate increases for people, these are people in the individual market, talk about re-energizing the advocacy community and everybody else, and the president. The president was furious about this. So very, I guess, foolish actually on their part, assuming that they didn't want any of this to pass. So we'll see. Then there's the issue of the abortion reproductive rights language, and the president's compromise plan says that there have to be at least 2 multi-state qualified plans in each exchange, and qualified means that it offers a minimum set of benefits that are decent. And at least one of them is nonprofit, and at least one does not cover abortion services. So this is one way to keep federal money from subsidizing abortion services. We can talk more about that later if you're interested. And so this is just to give you some general numbers. The difference between the House bill and the Senate bill really do actually matter in terms of how many people get coverage. If we do nothing by 2019, it's estimated we'll have around 54 million people without health insurance in this country. Under the Senate bill, we'd have 25 million remaining uninsured and about 17 million under the House bill remaining uninsured. Of this 17 million, about 7 million of them, and same in this 25, are people here in the United States illegally, and then the remaining are people that just are felt won't be able to afford the coverage available to them even with the subsidies. So I mentioned undocumented immigrants. In the House bill, well, first of all, in both bills, no undocumented immigrant would qualify for any sort of help in purchasing insurance. But in the House bill, if you could afford to buy it on your own, you could buy it through the exchange. In the Senate bill, which is where, and the president was silent on this issue, so we're assuming this is where he's at, you actually have to show proof of citizenship to buy a policy in the exchange. So that's where we're at with that. Both bills would, the House bill would close the Medicare prescription drug donut hole. The Senate bill would not. And the president, I think, is weighing in on closing the donut hole. So I think we're very likely to see that in the final legislation. Big increases of money for primary care and all sorts of primary care providers, not just physicians, but nurse practitioners, nurses, health aides, the whole picture, which we all know that we desperately need. And both bills would actually redistribute for physicians some unused residency slots toward primary care. They increase scholarships and loans for physicians and nurses who commit to careers in primary care. And there's a lot of money for public health and public health infrastructure. In the Senate bill, $25 billion over 5 to 10 years that would go into public health and wellness strategies, community health centers, and workforce. The president actually weighed in with $11 billion specifically to build more community health centers. So that's really good news. The physician payment system is going to move away from our current fee-for-service reimbursement, where basically physicians are paid to do tasks or things rather than paying for quality. So we like to say our current structure pays for quantity, not quality. And there's a lot of language in both bills that would move us towards starting to pay for quality instead. And these are very, very important steps that will ultimately and hopefully change how much healthcare costs in this country, and we'll certainly be getting more for what we pay for. And then in the Senate bill, there's another very important thing, which has also been very controversial, which is an independent Medicare commission that would advise on Medicare payments to hospitals and doctors. And it would have the authority to implement Medicare payment changes. Currently, Congress actually votes every time there's a fee schedule change. So you can imagine the lobbying and the politics and everything that goes on every time there's a change in the fee schedule. In fact, Medicare proposed some changes to how cardiologists are paid recently, and American College of Cardiology sued CMS, the Center for Medicaid and Medicare Services, because of these changes. And the suit was dismissed, but this happens every single time. There's like constant lobbying. So this board would be sort of like what the Fed has, a kind of a separate board that would be a little politically isolated that could make recommendations. And then a lot of money going into comparative effectiveness research to help doctors and nurses understand more clearly which treatments are the most effective. And would take some money away from Medicare Advantage plans, which are Medicare plans that are run by private health insurance companies. And they cost about 14% more than just regular Medicare plans. Now they do offer some other benefits, but they tend to be benefits like guaranteeing a private room or health club memberships or better support for vision services, that kind of thing. I mean, not that some of those things aren't important, but they do cost quite a bit more than regular Medicare plans. And so both bills would scale back Medicare Advantage monies. So bottom line in terms of revenue, the House was predicated, the House bill, on a surcharge on income. That was really the most important point. If you made more than $500,000 a year as an individual, or more than $1 million if you're filing jointly, there'd be a tax on that. In the Senate side, which is where we're going to end up, it was mostly predicated on an excise tax on group health coverage that's in excess of the policy has to cost more than $8,500 for an individual or $23,000 for families. So these are these high cost policies that everyone's been focused on. And that's also been very controversial because a lot of these folks are people like policemen or firemen who are in very high risk jobs, and so consequently they have very high risk health insurance or high cost health insurance. And some of these are people that are part of unions who have negotiated more generous health care benefits in lieu of wage increases. So this has been a very controversial thing to tax these plans. The president feels very strongly that it's an important component. So his compromise is he pushes it out to 2018, so even if he gets reelected as president, he won't be president in 2018. Very smart. And raise the amount of money. So for an individual, it would be a plan that costs $10,200, and for a family, a plan that costs $20,500. So we'll see what happens with that. And then the president also adds in a 2.9% tax on unearned income, like interest and dividends, that would be part of the revenue stream here. And there's a whole lot of other little things. So this is probably one of my most favorite cartoons I've seen this year. The most frustrating thing about healthcare reform is asking for a second opinion. So what I just showed you is the Democrats' plan. The Republican plan, I just have one slide because there's really not much to talk about in terms of formal plans. There's no plan out of the Senate. There's 2 plans in the House, maybe 3, depending upon how you want to count it. The Congressional Budget Office, which is the nonpartisan body that decides what things really cost, how much money these plans will really save, believes that the House Republican plans would extend coverage to about 3 million people versus the 30 million people that the Democrats' plans would extend coverage to. There's no individual mandate in the Republican plans, even though that was something actually that John McCain campaigned on. So it's just interesting how these things flip-flop. They would produce or offer tax credits to small businesses and individuals to encourage purchase, and they would expand state high-risk pools for people who couldn't afford insurance. Right now, today, state high-risk pools in the whole country insure about 200,000 people. So whether or not that's a real strategy that would actually help people isn't clear.